Hello friends, welcome to my YouTube channel Live Life, and today I'm gonna present you about the cure of diabetes. And yes, I know you all may be knowing about diabetes, what is diabetes, but you may not be knowing how to control it and how we can get not rid of, but yes, you can get free of diabetes. So let's begin. Starting from the first, let's see what is diabetes. Diabetes is a common group of chronic metabolic diseases that cause high blood pressure, that is glucose, levels in the body due to defects in insulin production or function. Let me say you, insulin is an enzyme produced by the pancreas. So if there is defect in insulin production or function, then we get diabetes, and it is a complex chronic illness requiring continuous medical care with multifactorial types. There are four types of diabetes: type 1, type 2, gestational diabetes, pre-diabetes. Let's move on and see what are they. Type 1 diabetes is categorized as an autoimmune disease and occurs when the body's misdirected immune system attacks and destroys insulin-producing beta cells in the pancreas. But the exact cause of type 1 diabetes is not completely understood. Type 1 accounts for only 5 to 10% of diabetes cases, but while it can occur at any age, most patients are diagnosed as children or young adults. People with type 1 diabetes must take insulin daily to manage their condition. Type 2 diabetes. This type of diabetes develops gradually with age and is characterized by insulin resistance in the body. The cells of the body stop being able to use insulin effectively, because of which the body's fat, liver, and muscle cells are unable to take in and store glucose, which is used for energy. The glucose remains in the blood. The abnormal buildup of this glucose, called hyperglycemia, impairs our body functions. And yes, family history and genetics play a major role in type 2 diabetes. People who are overweight and sedentary are at higher risk for developing type 2 diabetes. So, friends, don't be overweight and don't be sedentary. Just work hard so that you don't get diabetes. Now, moving on to gestational diabetes, it is blood sugar elevation during pregnancy. Yes, known to affect about 3 to 8% of women during their pregnancy, and left undiagnosed or untreated, it can lead to problems such as high birth weight and breathing problems for the baby. All pregnant women are tested for gestational diabetes age between 24 and 28 weeks of pregnancy, as this is when this problem usually develops. So, friends, if you are pregnant, or if your spouse or anyone is pregnant, please let them go and check for any sugar in their body, or they may have gestational diabetes during 24th and 28th weeks of pregnancy. Gestational diabetes usually resolves in the mother after the baby is born, but yes, women who have gestational diabetes have a much greater chance of developing type 2 diabetes. And the next is prediabetes. Prediabetes is not technically diabetes, but to be the first step to type 2 diabetes. This condition is marked by blood sugar levels that are too high to be considered normal, but are not yet high enough to be in the range of a typical diabetes diagnosis. It increases not only the risk of developing diabetes, but also the risk of heart disease and stroke. Symptoms. Moving on to the symptoms. With type 1 diabetes, the symptoms usually happen quickly, in a matter of days or a few weeks. They are much more severe too. In type 2 diabetes, some people don't find out they have it until they get problems from a long-term damage caused by the disease. It develops slowly and has mild effects. Now, moving on to the most important thing, that is treatment. It's unfortunate to tell, but yes, till today no cure for diabetes has been found. But if you care from your early time, you can control and even prevent it occurring at an early age. Insulin is the most common type of medication used in type 1 diabetes treatment, whereas for type 2 diabetes treatment, oral drugs are used mostly, and some comes in injection, where some people need insulin too. Insulin is given by injection and comes in different types, and the type of insulin you need depends on how severe your insulin depletion is. Now let's move on to top 10 diabetic foods. And they are egg white, that is, it is high in protein, avocado, fruit, almonds, aloe vera juice, that is jelly of the aloe vera plant, yogurt, of course the berries, and it will be more healthier and tastier if you have berries with yogurt, cottage cheese, legumes, that is chickpeas, oats, and finally peanut butter. And yes, there are other more important diabetic foods, but yes, these are the top 10. And the top 10 exercises for diabetes which are commonly you can follow up in your home itself are jogging or walking, squatting exercises, swimming, yoga, bicycling. It may be an artificial or the one you can ride in the road, dancing, treadmill, and you can also play your favorite sports, anything, but not indoor games like chess. Uh, and you should get involved in fun activities with friends, families, or children. It may be anything that you play with your children or your family, friends in your home. And yes, the last one is weightlifting. Thank you for watching. If you liked my video, please do like, subscribe, and click the bell icon to watch more videos. Bye bye.